broken files, deep defect, periapical destruction, indirect restoration. Very interesting, from endo to resto clinical case, special for you. Welcome back to the dental cases. This time we will discuss with you and show to you very interesting case from endo to resto, from retreatment to indirect ceramic restoration from A to Z. From the initial slide you can see that we have pretty interesting initial clinical situation with broken file, periapical destruction, very curved root canals and deep defect, as well as old direct restoration with broken distal zone, and we will have to rehabilitate this one in proper way. So what actually we do for such clinical cases? We start every single endodontic case to evaluate from restorative point of view. We have so-called concept that we name as restorative driven endodontics. That concept is making our life easy and less stress during the workflows. For example, if you combine endo and restorative part in your hands, so that concept may help you to be more happy with such clinical situations, especially when you do a so-called diagnostic treatment. So let us check. This is actually the checklist of actions and problems that we have before we start endodontic treatment. So we have a deep margin, and probably we will do deep marginal elevation, and we will have some problems with isolation in such a cases when you have deep margin. You can see actually on this slide, you can see that the filling itself is very close to the bone level here, so the isolation will be not easy. Okay, as well as here we have a broken wall, and the wall itself, the filling itself is pretty big. Okay, we have cracks, and we have here very thin walls. So basically, at the very beginning, we decided that we will do indirect restoration in this case because of the mentioned things. So first appointment, or let's say first step, restorative part. Rubber dam isolation. In this case, we do split down. Why split down? Because I realized that when I would be preparing cavity and I will be removing the filling and caries, I would break my rubber dam. We can do it without rubber dam actually, but when you do your split dam, it is easier for you. It is more comfortable for us because there is no tongue, there are no cheeks, and we can focus on the process that we do. Also, when we have split dam, we can do some manipulations with soft tissues, like gingivectomy, for example. And yeah, so that is the initial thing after I removed filling. In such a cases, we always start with impression, by the way. I just take a partial impression. You can use any material for impression as you want. This one is just for provisional restoration afterwards. So we can do initial impression, we do prep, we do endo, we finish our preparation, and then we do provisional restoration afterwards. In such a case, we decided to do indirect, so we started with cusp reduction. Making this cusp reduction, we are doing for us a favor because the working length will be shorter, so it will be easier for us then to do a root canal treatment. Then we removed filling, removed caries. You have to work very gently in the area of soft tissues. In this case, we use electric handpiece and red burr with a low speed, and even though you can have some bleeding. Electrosurgery or cauter, we just cut some gum around. Be careful with this moment. Then we applied hemostatic liquid. In this case, we used Viscostat clear by Ultradent, then refine margins with low speed. You see, after that application, after electrosurgery and using the hemostat and using electric handpiece, low speed and red burr, there will be no bleeding afterwards. So that is a trick. Then we would apply matrix. We will have to secure our matrix. In this case, we use Teflon. We pack it between teeth, adjacent tooth, and the one that we restore. And in adhesive protocol, bonding protocol, we go for we call it pre-endo build-up, but you can call it as deep marginal elevation. Okay, so now after we made this process, you can see here matrix, adaptation with Teflon. If you want more information about deep marginal elevation, I would refer you to read article by Master by Pascal Manier. You can see the reference in the low part of the slide. And after we finish our build-up, we can do normal isolation. So you can just replace your split dam with normal rubber dam isolation, and you are safe for providing irrigation procedure. If you want to increase your skills and knowledge in endo and restorative component, I would be more than happy to host you here in Ukraine in our training center. We have a very powerful hands-on course, which is called From Endodontics to Restoration, where we do primary endo, retreatments, and post-endodontic rehabilitation. This is a unique course, exclusive course, just only for 7 people. And we cover all these steps in hands-on mode. So you do everything on extracted teeth, integrated into the phantom, so it's like a 100% simulation of the clinical conditions that we have in our daily basis. So then, after we made that isolation, we do a root canal retreatment. We remove broken file, we treat the root canals, and then we end up with obturation. Now we are ready for next step, restorative component. We use sandblaster, very good thing to sandblast the dentin affected by sodium hypochlorite. In this case, we will do a core build-up. We'll use dual cured core composite material to make a build-up. And as you see, the tooth is already prepared for overlay. So we just need to do a build-up to refine our margins, and then we're ready for provisional restoration. So that is after our preparation. Then we do provisional restoration, and then we can go for next step. By the way, we have very powerful online masterclass about core build-ups, about fiber posts, about preparation for overlays, and for crowns. So the online masterclass called Rehabilitation of Endodontically Treated Teeth, Build-ups, Fiber Posts, Crowns, and Overlays. The link to this course you may find below this video. By the way, also you may find the link to our hands-on course From Endodontics to Restoration also below this video. And here you can see before and after endodontic treatment. We have followed up the case for 6 months with provisional restoration before going into final one. So we see that after 6 months we have healing process, and it gave us possibility to change provisional restoration to the final one. So you can see here the process of cementation of the final restoration. We did isolation, we sandblast, we provide bonding protocol, and we bonded our ceramic overlay after that endodontic treatment. So the case from A to Z with a sequence of actions as pre-endo, endo itself, following up, and final ceramic restoration. And everything that you see is just to have your like to the video and to sign up to our YouTube channel. By the way, when you put likes and signing up, our videos are available for many many people. Actually, dentists from all over the world are able to learn from that short webinars as you do. So don't be lazy, just put like, make your colleagues watch the videos as you do, and also we'll be more than happy if you like it and learn from our side. Okay guys, that's it. I would like to wish you to be healthy, to be powerful, and may the dental force be with you, and see you next time. Bye bye.